All right, today we are diving deep into the official medical playbook for one of the world's most rapidly spreading viral diseases, dengue fever. We're going to follow the exact high-stakes decisions that doctors have to make from that very first symptom all the way to the critical fight for survival. This is how they handled this incredibly tricky illness.
It all kicks off with something as simple as a mosquito bite. But how does that escalate? At what point does a fever and a bad headache spiral into a life-or-death situation? That is the question at the heart of this entire medical playbook.
So, just to be clear, the steps we're about to walk through aren't just suggestions. This is the standard protocol. This is the guide that medical professionals all over the world turn to when every single second is critical.
Okay, so let's start at the very beginning with the first signs. The tricky part here is that the symptoms can look like a dozen other illnesses. So how do doctors even begin to suspect that dengue is the culprit? Well, the first clue is all about context. It's never just about a fever. If a patient is in an area where dengue is known to be active, doctors are immediately on high alert. They're looking for that fever, yes, but it has to be paired with at least two other very specific signs. And these are those initial signs they're looking for. Things like really bad muscle and joint pain. There's a reason they call it breakbone fever. You'll also see a nasty headache, and a very telltale sign is pain right behind the eyes. Now, at this stage, it's just considered dengue without warning signs. The main thing is to manage the fever with paracetamol. And here's something absolutely crucial: avoid NSAIDs. That's things like ibuprofen. They can actually increase the risk of bleeding, which is a massive concern with dengue. But this is just phase one. The real challenge could still be coming. And now we get to the most pivotal moment in this entire journey. This is the fork in the road where the illness can take a turn onto a much, much more dangerous path. These are what doctors are watching for with laser focus. You can think of them as the body's own alarm system, screaming that the illness is escalating from a standard case into a genuine emergency. And the presence of even one of these signs is a huge red flag. And just look at how specific these are. We've moved way beyond general aches and pains. Now we're seeing signs that the body's systems are starting to get into real trouble. Things like vomiting that just won't stop, or bleeding from the gums or nose. The most dangerous one here, though, is fluid accumulation. That means plasma is literally leaking out of the blood vessels. This is what leads to a weak, rapid pulse and clammy skin, and it's the trigger for immediate, aggressive action. So what happens when those alarm bells start ringing? The patient is now in a full-blown crisis, and they're at risk of something called dengue shock syndrome. Let's break down how the medical team responds. Now, it's super important to know that shock actually happens in two stages. First up is compensated shock. This is where the body is in overdrive. The heart is just racing to try and keep blood pressure normal. But it's a very fragile balance. Without immediate intervention, that patient can crash into hypotensive shock, and that's when their blood pressure absolutely plummets. The situation becomes dire. And the medical response is lightning fast. It all starts with the basics, checking the ABCs. That's airway, breathing, and circulation. Then they immediately start oxygen and give what's called a rapid fluid bolus. This basically means they are quickly pumping a large volume of a sterile salt solution, called a crystalloid, right into the veins. The entire goal here is to refill the circulatory system and get that dangerously low blood pressure back up fast. But here's the reality of emergency medicine. The first intervention doesn't always work. So what happens then? Well, the playbook has a very clear decision tree for what to do next. Okay, so to decide on the next step, doctors recheck a key lab value, the PCV, or packed cell volume. Think of it as a way to measure how thick or thin the blood is. If the PCV has increased, the blood is too concentrated from all that plasma leaking out, so they switch to colloids, a different kind of IV fluid designed to stay in the blood vessels longer. But if the PCV has decreased, that is a massive red flag. It almost always means the patient is bleeding internally, and a blood transfusion is needed right now. This brings us to a really critical set of tools in the dengue crisis playbook: blood products. But this is not a one-size-fits-all kind of solution. Yeah, this isn't just about giving any blood. It's about giving the specific part of the blood that's needed most. If the patient has lost a lot of blood, they get packed red cells to carry oxygen. If their blood just can't clot because their platelets are all gone, they get a platelet transfusion. And if the problem is with the liquid part of the blood that holds all the clotting proteins, well, they receive fresh frozen plasma. It's an incredibly precise approach to a life-threatening problem.
So after navigating through that intense crisis, the focus finally shifts. How do doctors know when the danger has truly passed and the patient is finally on the road back to health? The very first positive signs are the ones you can see right at the bedside. The fever has been gone for at least 2 days. The patient just seems better. Maybe they have an appetite again. And crucially, their vitals are stable, meaning their blood pressure and heart rate are normal without needing a ton of medical support. These are the first green lights that tell everyone the body is finally winning the fight.
But just feeling better isn't quite enough. The playbook requires hard proof from the lab, and doctors need to see two very specific things. One, the platelet count is finally starting to trend upwards. And two, their hematocrit, that blood thickness measure, is stable all on its own without the help of IV fluids. Once both of those things are clear, the crisis is officially over and the patient is safe to go home.
So we've just walked through the entire playbook for saving one life from dengue. But as this disease continues to expand its reach into new territories, the question gets a lot bigger. Does every hospital have this playbook? And more importantly, are they equipped to actually execute it? That is the challenge that we're all facing now.